let's talk about exercising during pregnancy. For a long time, the advice was basically, don't. But you know what? That thinking has completely flipped on its head. Today, we're diving into the modern, science-backed guide for staying active and having a healthier pregnancy. So let's get right to it. So, you're pregnant. And maybe you're wondering, what's the deal? Should I be kicking back on the couch for 9 months, or should I be lacing up my sneakers? For generations, the answer was always rest. But science is asking a much better question now. Is resting really the best thing for you and your baby? Well, the answer today has done a complete 180. That old rest is best idea, it's totally outdated. The new guidelines are all about empowering you. They show that for most pregnancies, moving your body isn't just safe, it's absolutely essential. So first up, let's rethink what pregnancy fitness is all about and look at the new evidence-based consensus. Now this isn't just some friendly advice. This is the official word from the American College of Obstetricians and Gynecologists, ACOG for short. And look at those key words, should engage and throughout all 3 trimesters. This means exercise is no longer an optional add-on. It's now considered a core part of a healthy pregnancy right from the very beginning. And here's the number to remember, 150. That's 150 minutes of moderate intensity aerobic activity every week. Now, that might sound like a lot, but you can break it up however you want. Maybe it's 30 minutes, 5 days a week. Or, hey, if you're busy or tired, even short 10-minute walks spread throughout the day totally count. Okay, so why the big push for 150 minutes? Let's get into Section 2, the powerful benefits. And honestly, the evidence here is just so compelling for both you and your baby. This is where it gets really incredible. Just look at the impact on some of the biggest pregnancy complications. Regular, moderate exercise can slash your risk of both gestational diabetes and gestational hypertension, that's high blood pressure during pregnancy, by a staggering 40%. I mean, that is huge. And the benefits don't stop there. They continue all the way through to delivery. Mamas who stay active see, on average, a 34% drop in the rate of C-sections. That is a massive difference and really shows you how getting your body prepped can literally change how you give birth. And the list just keeps going. We're talking a shorter first stage of labor. Who wouldn't want that? Fewer symptoms of depression, less of that nagging low back pain that so many people get, and just better sleep. These aren't just little perks. They can fundamentally change your entire experience of pregnancy for the better. Okay, so you're convinced. But what kind of exercise are we actually talking about? Let's open up the toolkit and look at the safest and most effective moves you can do. All right, for your cardio, you want to think low impact. Walking is just fantastic. Almost anyone can do it. Swimming is a total game changer, seriously. The water supports your weight, taking all that pressure off your joints and your back. It feels amazing. A stationary bike is also great because there's no risk of falling. Now, what about running? If you were already a runner before you got pregnant, you can probably keep going, but that's definitely a conversation to have with your doctor first. Next up, and this is something people often skip, is strength training. Now hold on, this isn't about setting personal records or getting ripped. It's about maintaining muscle to support your changing body, to help manage weight gain, and to build that real-world strength you're going to need for labor and for carrying a baby, a car seat, and a diaper bag all at once. Core work is also absolutely critical, but you have to do it the right way. You need to avoid old-school exercises like crunches. Why? Because they can actually make a condition called diastasis recti, that's the separation of your ab muscles, even worse. Instead, you'll want to focus on things like pelvic tilts, bird dog, and modified planks. These moves strengthen your deep core muscles safely. And we can't talk about the core without talking about the pelvic floor. Doing Kegels correctly is so important. Let's walk through it real quick. Just sit comfortably. Now imagine you're trying to stop the flow of urine. Squeeze and lift those muscles inside. Hold it for a few seconds, and now, this is key, fully relax for a few seconds. That's 1 rep. You want to aim for about 3 sets of those a day. Okay, so you've got the moves, you've got your toolkit. Now let's talk about the rules of the road. How to exercise smart and safe. As your body changes, your workout has to change with it. In the first trimester, honestly, the biggest challenge is usually just fatigue and nausea, so listen to your body. The biggest rule change comes in the second trimester. After about 16 weeks, you need to avoid exercises that have you lying flat on your back. This can press on a major blood vessel and actually reduce blood flow to the baby.
Then, by the third trimester, your center of gravity is all different, so it's time to ease up on the intensity and steer clear of anything that challenges your balance too much.
All right, pause for a second. This next part is completely non-negotiable. Your body gives you warning signs for a reason, and your number one job is to listen to them. You have to stop exercising immediately if you feel any of the following.
These are the big red flags. We're talking vaginal bleeding or any fluid leakage, regular painful contractions, chest pain, feeling dizzy or faint, or noticing that your baby isn't moving as much as usual. These are not things you push through. These are signs to stop what you're doing right away and call your doctor or midwife, period.
And finally, there are just some things that are off limits for now. That means contact sports like soccer or basketball, where you could get hit in the stomach, activities with a high risk of falling, like skiing or horseback riding. Scuba diving is out because of the pressure changes, and anything in extreme heat like hot yoga is a no-go because you don't want to raise your core body temperature too high.
Okay, we've covered a ton: the why, the what, and the how to be safe. So let's pull all of this together into one simple, healthy pregnancy blueprint.
Here it is, your whole week right at a glance. You're aiming for that 150 minutes of cardio for your heart. You're getting in 2 or 3 strength sessions to prep your muscles for labor and motherhood. And then every day, you're doing your pelvic floor and breathing exercises. This balanced approach really covers all your bases: heart health, strength, core stability, and even mental prep.
So the evidence couldn't be clearer. Movement really is medicine during pregnancy. The goal isn't to be some extreme athlete. It's about consistent, smart activity that prepares your body and your mind for one of the biggest things you'll ever do. So the question isn't if you should move, it's how are you going to get started? And you know what the best first move is? Having a chat with your doctor to create a plan that's absolutely perfect for you.